Hello, everyone. I think we're about ready to start, so we might just start, if that's okay. Welcome to our first webinar for 2021. Before we begin, I would like to acknowledge the Bejigal people that are the traditional custodians of the land on which the UNSW Kensington campus stands. I would also like to pay my respects to the elders, both past and present, and extend that respect to other Aboriginal and Torres Strait Islanders who are present here today. Today, we are delighted to have Dr. Megan Blaxland presenting on the 5 aspects of effective engagement in early childhood education: approachability, acceptability, availability, affordability, and appropriateness. Dr. Megan Blaxland is a research fellow at the SPRC at UNSW. Her research focuses mainly on the implication of policy for low-income families, particularly Australian Early Childhood Education and Care, the ECEC policy. She's currently working on the ARC linkage project, engaging families in early education, which includes 6 case studies of high quality ECEC services who connect well with local families who have found early education difficult to use. Before handing over to Megan, I just want to flag that the seminar is being recorded and a link will be emailed within the week to all who registered. Also, if you have any questions for the presenters, please submit them via the chat function and we can go through them in the Q&A session after the presentation. There is, of course, also ample opportunity for you to raise your hands and ask the question yourself. One last thing, or 2 last things actually, is before Dr. Jen Scatterpold and Dr. Elizabeth Adamson will also be joining the Q&A time. They've also been a part of this project. And the second thing is, in line with our environmental policy at UNSW, we would recommend that people turn off their videos, which I think most people have already done, because we apparently reduce the ecological footprint that being on the internet causes. Thank you very much. I'll hand over to Megan now.
Thank you very much, Yvisti. So I would also like to acknowledge that I live and work on Aboriginal land, and in my case, that's Gundungurra and Darugland in the Blue Mountains outside of Sydney. And I pay my respects to the Gundungurra and Darug communities and their elders, and to all the Aboriginal people who are joining the seminar today. We've started what I consider to be a really lovely practice in a lot of our meetings and seminars that we've been running at SPRC, where we encourage people to acknowledge the many lands on which you are in the chat. So if anybody feels like doing that, feel free. I find it incredibly interesting and educational to see. I'm learning more and more about Aboriginal lands as a result of that small practice. As Yvisti said, Jen and Liz both work with me at SPRC and were co-authors of the report on which this seminar is based. And so they will be paying attention to your questions throughout the seminar and coming into the chat so we can talk about those at the end. The project was funded by the UNSW Gonski Institute for Education, which is a great initiative set up to further equality in education. And I also like to thank our sector advisors, who are Adrian Piccoli from the Gonski Institute, Gabby Holden from KU Children's Services, Elizabeth Deeth from the Early Learning and Care Council of Australia, Stacey Fox, who was at the time working with the Front Project, and Kate Highfield from Early Childhood Australia. 2008 marked an important milestone in Australian early childhood education and care, when all jurisdictions agreed that all children should engage in 15 hours per week of early education in the year before school. And since then, massive and coordinated endeavours have led to substantial increases in the proportion of children who attend early education. And as a result, today, most children do participate in early education, whether through a preschool service or a preschool program delivered through a long day care service. However, although described as universal access, we do not have a universal ECC system. Participation in ECC increases from birth up to the year before school. So looking at that year before school is a good way with which to assess the reach of our system. So we know some children don't attend, but it's hard to judge just how many, because counting people who are not doing something isn't an easy thing to do. But using population estimates, the Productivity Commission in the report on government services calculates that 95% of children are enrolled in a preschool program in the year before school, while the Australian Early Development Census, based on teacher reports at the beginning of school, reports that 85% of children attended a preschool program. So we've got somewhere between maybe 5 and 15% of children who are not engaging in early education. Of course, some families may prefer to keep their children at home, and some may attend ECEC where preschool programs are not recognised, such as in family daycare. But we do also know that some families do not engage in ECEC because they find services difficult to use. And we know that families experiencing adversity are more likely to be in this group. So early analysis of Australian Early Development Census data showed that nearly 40% of Aboriginal and Torres Strait Islander children and 35% of children living in low-income areas were not attending ECEC. And while programs targeting low socioeconomic status communities can be highly effective, more recent analysis of AEDC data shows that many children from low-income families do not, so they don't live only in low-income areas, but also in each of the other CEFA quintiles, children from families with low incomes are not as likely to be as ready for school as their wealthier peers. And this is a concern because we know that when children start school without the skills that they're expected to have, it can mean that it's hard to keep up with their peers throughout their school years. And in their early years, it means that families who are struggling can remain isolated and miss out on the kinds of connections to support services that good ECEC services can provide. So we know quite a lot about why this is a problem, but we don't know enough about how to address it. And so in this project, we aimed to document the systems and policies and practices which act to improve engagement in high quality early education and care of families facing economic and other disadvantages. The Australian ECEC system is complicated. All levels of government are involved, as well as many other players. The Australian government, for example, provides funding through fee subsidies for families, primarily through the childcare subsidy, which in the years before school is available to children attending long daycare, family daycare and occasional care, while state and territory government funding is primarily focused on preschool education. Regulation is shared between those two levels of government. Australian ECEC is offered through a mixed market that includes large corporate providers, small family-run services, and government and community managed services. Added into this mix are playgroups, which are commonly run by volunteers, other early childhood and family support programs which link into ECEC services, and also a number of brokerage services who are designed to link families to ECEC, often funded by philanthropy. And for the first time for us, we brought these brokerage agencies into this study. Despite this complexity, in recent decades, the regulatory landscape has become more unified through the introduction of the Early Years Learning Framework, which provides curriculum guidance for early years services, and the National Quality Standard, our quality assurance scheme. And the NQS is also very useful for the data it provides us. And so it shows us how quality varies across the country and in different parts of the sector. Unfortunately, from that, we know that high quality services are not available to all children. In September 2020, 18% of services did not meet the National Quality Standard. And while this proportion has been falling steadily over the years, it's still too high. And there are clear patterns in the data such that the highest quality is concentrated in services that are government and community managed, in preschool and kindergarten services, and in high socioeconomic status communities. And this is seen in other research as well. So the E4Kids study, for example, reported that only 7% of families with a lower socioeconomic status attended services in the top quintile for instructional quality, compared to 30% of children from families with a high socioeconomic status. We know too from data from the National Quality Standard that It's the areas of educational program and practice, staffing arrangements, and governance and leadership that are the most challenging for services in disadvantaged locations, and that services in those neighbourhoods are also more likely to have a waiver regarding the level of qualification required by their staff. So in thinking about how the sector might work with families facing adversity, it's also important to consider its capacity, not just at the service level, but also to think about where else services might access support. So we did an analysis of the National Quality Standard data and found that of all centre-based services in the years before school, just under half are standalone services, whether a small community-run operation or a small family business. And there's a small proportion which are run by small providers that have just 2 to 4 services. And then the remainder are large providers or are connected to larger institutions like schools or local governments or other state government departments. And later in the presentation, I'll come back to this to show why this picture of the sector is so important. The framework we drew upon for this project takes an ecological approach to service engagement. It acknowledges the interactions between the micro level of families, the meso level of services, the macro level of neighbourhoods, and the exo level of public policy. It provides a comprehensive and coherent way in which to identify and work towards effective engagement in ECC. It begins, as you see at the top, with family resources, what it is that families need or what they need us to support them with to effectively engage in ECC. And then it illustrates what the service system needs to be easy to use for families. It steps through the key factors that enable or constrain access to ECC from a family standpoint, and offers a way of thinking through and ordering the complex and interconnecting elements of the ECC service system. It allows us to identify what needs to change at a system level to facilitate the micro-meso engagement of a family with a service. And this is really useful because we know that sometimes when families first make contact with an ECC service, they're in survival mode. They might be fleeing domestic violence. They might be dealing with a sudden and unexpected serious illness. They might be managing mental ill health or navigating the difficult path to a disability diagnosis. And sometimes people are experiencing a cascade series of crises. And in these circumstances, deep engagement with a service might be very difficult. So this framework can help identify what our service system needs to do to help those families connect and stay engaged, and for their children to do well in ECC. The framework has 5 aspects of engagement. And in this project, we focus largely on this blue section along the bottom on policy and services. We conceptualize the aspects as steps in a progression towards deeper engagement between families and services. The 5 aspects are approachability, acceptability, availability and accommodation, affordability, and appropriateness. So on the left, at the most minimum level, a service needs to be approachable before any engagement can happen. On the right, at the deepest level of engagement, services are provided in ways that are appropriate to the needs of children and their families. And the sequencing of the aspects follows the steps a family might go through as they take their child to ECC. But the different aspects may be more or less important as the family is connected to a system develops. And so, for example, the aspect of acceptability might be vitally important at every step for some families, yet recede in urgency for others. So engagement doesn't necessarily follow a linear progression from left to right. So in this presentation, I'm going to present some of the insights from our findings on each of these 5 aspects. We found deep understanding and high levels of consensus across the first 4 aspects of the framework. And many of these, for those of you who've been in and around ECC for a while, will be familiar to you. The findings matched well to the 5A's framework, which gave us confidence in the usefulness of the framework and also confidence about our findings and the new insights which we've come across, particularly with regards to the 5th A, appropriateness. This was the most complicated in our research and quite interesting. And so I'm going to describe that in more detail towards the end. And then also at the end, so across all of these A's, there are implications for the capacity of the sector to work with families facing adversity, particularly in terms of skills and training and costs. So I'm also going to come to those at the end of the seminar. The research is based on a modified Delphi study, which is a method for determining consensus regarding a complex problem. Our research addressed what could or should be the policies and practices that support equitable access to high quality ECEC. Our advisory group recommended participants with expertise in this area, including service directors, people working for large and small providers, often with a focus on equity or inclusion, and people from organisations that work to facilitate the engagement of children in early education. And then in addition, we recruited other participants through snowball techniques, in which some research participants recommended others who might be interested in becoming involved. We first conducted quite structured interviews, one-on-one with each of the participants, and then we analysed the data for common, outlier and novel themes. We then shared these initial findings with the research participants in an anonymised summary report, and we encouraged them to reflect, critique and offer their opinions, whether towards consensus or dissensus. We used that second wave of data to rethink our first analysis and write the report. I'm also in this presentation going to draw upon the experience of a family that we met in a previous study. Jen and Liz and I were all involved in Families at the Centre, which was led by Deborah Brennan. So I met Bobby in one of our research sites, and her story continues to inform my thinking about early education and what it means for families. Bobby was determined that her children start schools with the skills that they'd need. And from her own experience, she knew that it was important that they had foundations in writing and numeracy and reading. And she also knew they should know how to listen, to be patient, and to sit still when asked. We met Bobby in a caravan park where she and a number of other families were living at the time. Bobby was a strong, no-nonsense woman who was incredibly insightful about how families like her were perceived by others. She said to me, as someone who'd grown up and continued to live in poverty, that people like me are judged like a horse by their teeth and their shoes. I think that may well be the most powerful thing that anyone said to me in any interview. Bobby enrolled her two oldest children in long daycare because she knew that this should help them to prepare for school. But she quickly became disillusioned with the service. She said, they've got to teach them something there. But she observed that they did not. You can see here her describing the kinds of things she was hoping might happen at long daycare, some flashcards, sitting time, little things like that, patience, because I reckon at that age you can teach them patience. It makes things a little bit easier. Of course, every kid has trouble with patience, but if they're taught a little bit of patience. So becoming disillusioned, she withdrew her children so that she could teach them at home instead. And when her younger children were old enough, Bobby decided to help them get ready for school at home too. So throughout the presentation, I'm going to refer back to Bobby's story to add a bit of the family's perspective to this framework. And I encourage you to think about families and services and circumstances that you've encountered too over the years. And maybe in the discussion, we can have a chat about some of these. So the first A, approachability. Approachability refers to a service system characterised by initiatives that ensure all families know that ECEC services exist, they could work for them, and they understand the first steps in locating services and feel they could make that initial contact. To understand how to improve approachability, our participants noted, as this one said, it's important to habitually ask, who is not here? And then with the knowledge that some families were not engaged with EC services, the participants most commonly discussed outreach practices as key aspects of approachability. So overall, there was a very high level of consensus on strategies for outreach and why they were important. There was agreement and confidence among the participants about what effective practices looked like and why they were effective in reaching families. And you can see here some of the examples they gave us on how they went about doing this and some of the aspects of outreach that they engaged in. Participants also noticed that interagency connections were particularly important for finding and connecting to families. And while some took part in formal interagency meetings, this was sometimes something that was difficult to resource. So if a staff member had to take time off working on the floor, then that meant that obviously it had ratio implications. You need to find someone else to take their place on the floor. Others took then a more informal and broader approach. And so one described setting up what she called informal coffee meetings with key people in her local area. She told us that it was important to be known by the local real estate agent and the hospital. We also found that brokerage agencies were especially important. These were most often operating in areas where there were larger numbers of families not engaging with ECSE, and they had the resources to work with families in a wide range of ways, as you'll see through the course of the project. They ran play groups, they provided transport, they took part in many different activities. They also ensured that ECC services were linked to other organisations in the area. And this was important for Bobby. So she knew about ECSE and knew of the benefits it was supposed to offer. So the system was initially approachable for her, but then after she withdrew from formal services, she remained somewhat connected through the mobile play group that visited her caravan park. And this left an important opportunity to reconnect her with formal services. But formal services would then need to be acceptable for this to work for her. Early childhood education needs to be acceptable to families if they are to take further steps to enrol their children. This means that those in services working at the first point of contact need to be responsive to families, their values, and the meaning they attach to education. Culturally, families may not see the benefit of ECC attendance. Some families do not consider accessing an ECC service to be necessary or important if there's a parent available to care for their children. Acceptability indicates the services are compatible with family communication styles, protocols, and values. It underpins good quality interaction between ECC staff and families. It's a dimension that's pertinent before enrolment, but it also links into its services capacity to be accommodating and appropriate throughout a family's engagement. To ensure services were acceptable to families, participants discussed ways in which services attempt to help families feel safe, and high amongst these was cultural safety. Several discussed the benefits of employing staff from the same backgrounds as families in their local community, which helped families see themselves reflected in the service staff and facilitated communication and the development of trust. Many participants spoke of services employing Aboriginal or Torres Strait Islander workers or engaging with cultural brokers such as elders or other trusted community members. This service here, for example, recognised that the diversity in the local Aboriginal communities around their service meant that they needed a number of different Aboriginal staff to connect with families. Another participant spoke of the need to help families feel secure in their first engagement with services, noticing that they might feel unsure of themselves engaging with children's services, where everyone else has had training and experience in working with children. This might be particularly an issue if a family were worried about child protection services becoming involved in their family, or if they've had very negative past experiences with authorities and education systems due to poverty, blindness, or racism and issues in their own childhood with child protection. The participants spoke of the careful, skillful approaches needed in these circumstances. So from Bobby's point of view, the formal ECC system was incommensurate with her values and expectations around school readiness. And having already tried and dismissed long daycare, Bobby would need a very skilled playgroup worker to slowly and gently reintroduce the idea that formal services might be worth trying again. Availability describes whether or not there are places available for children in the kinds of services families would like to access in the right locations, often in their local neighbourhoods. So, and then accommodation extends this idea to the ways in which services take account of families' particular needs for a place across a day and across a year. Are the places that are available at the times families need them, on the days they need them, through the course of a week, a fortnight, a year. This is an issue both at a service level, but it also connects to the broader ECC system. And the most obvious example of that at the moment is the way that the childcare subsidy activity test reaches across a fortnight and the interactions of that with the service practices. Participants explained that enrolment was often difficult for families, especially when they have negative experiences with authorities through migration or dealing with child protection, as I mentioned. Brokerage agencies in particular offered very flexible, very practical support, and often families needed to set a number of things in place before they were able to enrol. So they might need to catch up on immunisations, or they might need to secure copies of immunisation records or birth certificates or other documentation. Brokerage services, so this brokerage service here describes how incredibly accommodating they are of families' needs as they negotiate their way through the enrolment process, even as they say, meeting at McDonald's to go through the forms together if that's what works. Services were also very flexible at this stage. One told us, for example, that they know that families are managing a lot when they first enrol their children, and so they might be, for example, attending many appointments. They might have court appointments, doctor's appointments, occupational therapist appointments, and many other pressures on their time. And this might mean that they need to cancel or reschedule appointments with the ECC service, and that might happen a lot. So this service made a point of always accommodating these kinds of changes. Availability was an issue for many of the families living in the caravan park where Bobby lived, and a big part of that for them was around transport. So very few of them had access to cars, and the local public transport system was pretty unreliable and fairly infrequent. So it was difficult for them to travel to any formal ECC services. And as well, many of those families had quite unpredictable lives with complex multiple problems. For many, these would have made regular attendance at formal services difficult to maintain. Those families needed highly flexible accommodating services that could match their children's enrolment with the irregular days that they might have been able to attend. So the fourth A is affordability. So this means providing ECC at a cost that families can manage to pay. The cost can be kept low through government subsidies and government's funding services, but it's also connected to service policies around enrolment bonds and fees. And in addition, the capacity to pay isn't something that's fixed. So for many families, this may change over time. The complex policy around ECC in Australia makes affordability a messy picture. So in some states, preschools are widely available at very low cost, or there are additional subsidies available for some families. Local governments often run ECC services in areas where the market cannot or does not provide services, and they often subsidise fees so that they're affordable for families in their local communities. The childcare subsidy, while it's available across the country, isn't available for preschool services. So participants had a lot to say about the childcare subsidy. They felt that many families new to childcare did not know that the subsidy exists, and they described applying for the subsidy as complicated and difficult to navigate, especially where families didn't have the computer equipment or skills or sufficient English language literacy to go through that online system. And in particular, they pointed to the fact that the activity test meant that children from the lowest income families, where parents were not working, have very limited access to subsidised care and education. So for Bobby, affordability was a key issue. She had very, very little money. Having food available for their children each day was not something that the families in the caravan park where she lived could count on. They were not sure that they could do this. They made difficult decisions every week about every cent, including whether or not they could manage to stretch another day before buying the next loaf of bread. And Bobby did not see that long day care was value for money. She said to us, I had them at long day care, but I felt like I was wasting my money because I was just paying for them to go somewhere else and play. You could take them to a park and save that money. They were learning more and doing more at home than what they were doing there. So as she indicates here, Bobby's key criticism though, despite affordability being an issue, was around appropriateness. So that's our 5th A. Appropriateness determines how effectively a service can meet the needs of families over time, both through parent engagement and pedagogy. Appropriateness covers the elements that make a service useful for families, responsive to families, and the elements that help them support their children to meet family goals, such as learning for school readiness and for cultural group membership. Services are useful when families' needs are met and when their children feel safe and learn. So as I mentioned at the beginning, appropriateness was the aspect of engagement where we found the widest variation in strategy, and with regards to pedagogy, the least detail. So everyone agreed that once services and families are in contact and administrative processes are complete, that services need to effectively engage with families and settle children into the everyday practice of the service. And orientation was a major part of this. There was a high level of agreement about the elements of good orientation, but the approaches that were described to us fell on a continuum from very formal to very informal. So at the most formal end, one participant described emotional care plans. They developed these with families and with other relevant stakeholders, and they're intended to reflect family needs, outline learning and development support needs, and set out strategies that could be used both across at home and in the early learning service to provide consistency of care for the children. They also offered families with private opportunities to discuss difficulties that they might be experiencing. For example, if there are a court order in place. And working through these complexities with families in an explicit manner can contribute to parents' sense of partnership and of safety. At the other end of the spectrum, one participant told us that they were deliberately very informal in their orientation. This service had set up a welcoming seating area near the street so that families could come in with their children and observe without having to speak or engage with any workers. They felt that families wanted to get the look and the feel of the service before talking in any more detail. And they encouraged families to come and stay in this observing space as long as they wanted and as many times as they wanted. So the idea of families as partners featured strongly in relation to orientation, despite the different approaches that services took. And there was agreement on the main ingredients of orientation. But with regards to pedagogy, there was widespread agreement on the importance of high quality teaching. But unlike most other aspects of engagement, the idea of partnerships with families was less well developed with regards to pedagogy. We know that effective pedagogy builds on what children already know. Most research participants felt that the early years learning framework is a useful curriculum scaffold that builds on children's knowledge. However, they didn't articulate how this might be operationalised in high poverty context. And the lack of detail regarding pedagogy was notable in contrast to the very high levels of detail offered about the other aspects of engagement that we explored. One of our participants, who delivers professional development to educators working in disadvantaged areas, explained the importance of taking a funds of knowledge approach. She described how often children are offered a play corner where they reenact going to a restaurant with menus and tablecloths and so on, but pointed out that if this experience is unfamiliar to children, it has no meaning. In high poverty contexts, educators need to research the familiar experiences children have, like going to a doctor or a clinic, and seeing how oral transactions take place, and then have a chance to reenact this experience. But we know from the literature that it can be difficult to access the knowledges that children and families bring to ECC, particularly in contexts of disadvantage. Families often require privacy to feel safe in order to talk about these things. And sometimes talking privately can be difficult in ECC services. Or families might doubt their own knowledge due to past experiences of being treated badly at school themselves or feeling badly judged as a parent. So to build on children's existing knowledge, this participant suggested that educators become researchers of their own local communities. So she pointed out the importance of asking questions of families. What are they happy to share? What are the things that you really like to do? Oh, so you're a dancer. Would you be interested in helping us on such and such a day? And she noted that some families may lack confidence in their own resources or capabilities or skills, so that when they see that some of the things that they've talked about are being valued, they get a different sense of who they are in relation to their children's learning, and they become more interested in what they can contribute. And so then educators are better equipped with the understandings they need to help children build on the learnings they already have. So from what you've heard already about Bobby, you'll see that in this aspect of engagement, her service failed her. Bobby never saw children learning at long day care. She only saw play. Nobody raised the idea of play-based learning with her. But more importantly, nobody asked her about her priorities for her children's learning. No one asked her what they did at home. Bobby had no sense that her educational priorities were at all aligned with those of the long day care service. But she could have been so much more engaged. Bobby loved teaching. She loved working through the ABCs with her children and counting with them to 10. She could have been invited to spend time at the service reading to children, or working with other educators on a maths project. And maybe over time, these could have been an opportunity to talk with her about how the education she so valued is based in play in early education. But instead, she felt judged and dismissed. She had a lot to offer the service and a huge enthusiasm to education, and that could have been the foundation for a respectful partnership with educators, in which they worked together to help her children learn. So throughout the research, it was clear that working with families facing adversity requires a high level of skill. And while we know such skills are critical, we don't yet know enough about these kinds of skills or who has them. And we need systemic change to ensure that educators have training in these skills and that they can access that training. So this includes ensuring that early education courses at universities and other institutions teach engagement skills, and that directors and administrators and educators at services have access to appropriate support and advice. Remembering from this graph that I showed you at the beginning that many operate as standalone services or part of small providers that probably don't have any broader infrastructure to support them, to support families. The inclusion support program can do some of this work, but it falls down when families are cautious about engaging with a system that labels their child as at risk or having a disability or another condition that might require intervention. Brokerage agencies, where they are available, can be excellent resources in these situations, but they're not available in all locations. Offering a service with appropriate early learning might be particularly difficult for services in very high poverty contexts, remembering, as I told you earlier, that these services are the ones that are most likely to have qualification waivers for their staff. So we need to think about how the sector as a whole and our policy and our funding systems can support all services to provide excellent education. Providing the additional supports that they did to connect and build relationships with families, and then supporting them through times of hardship involved considerable costs to ECC and brokerage services. It entails additional staff time to engage with families and services beyond the gate, to work closely and patiently with families when they become connected to services. And some services also offer deliberately low fees or bond waivers, or they might cover the costs of fees while families wait on subsidy application outcomes, and these are all a loss of revenue. So these two services quoted here decided that they needed to increase their staffing with associated increases in costs in order to appropriately engage with families. But they needed to fund this additional expense. And so in services connected to very large providers, sometimes there are cross-subsidisations that happen here, and others spent considerable time seeking grants from state and federal government, with the challenge that these grants are often short-term and project-focused and rarely offer ongoing funding security. It's not easy to resource the additional costs that these services incur. Areas where brokerage services operate can offset some of the costs for ECC services because they can turn to these outside organisations for support. And this gives you an indication of some of the costs of a brokerage service. So there was one operating in a city of 500,000 people that employed 20 staff, which connected families with services, ECC services, and another that had 2 part-time staff in a urban local area of 60,000 people. We need, though, to better understand the costs of engagement and how the ECC system can better support services attended by families facing adversity. Because at the moment, securing funding is difficult and piecemeal. So we found this to be a very fruitful project in which we learned that there are high levels of consensus and understanding on the kinds of practices that facilitate family engagement in ECC. And we found the 5 aspects of engagement framework to be very useful, a useful way in which to think through the many dimensions of engagement for families. We really hope to see this framework used more widely. We think it has great potential for everyone, including services, service managers, providers, and policymakers. In this research, the framework helped us identify key areas for improvement regarding engagement with families, the high levels of skill that are required to work with families, whether in the earliest point of contact or in their day-to-day learning. And we need to know more about these. We know that there is a need for training in how pedagogy might adapt to the funds of knowledge that children bring from home, so that early education can build on what they already know. And as I just said, that working with families in facing adversity can be costly, and we need to understand more about how to fund this. If Australia is going to meet its aim of universal access to ECC, we need to ensure that it's a system that's easy to use, that it's welcoming and safe and rewarding for all families. Then the report that I've based this presentation on is available as of today on the link that we have available here, and I encourage you to have a look at it. There's a lot more detail and information and explanations of the framework. Thank you. Hopefully now Jen and Liz will come and join me and we can have some questions and discussion.
Thank you very much, Megan, for a very sobering account of the engagement capacity and potential in the ECEC sector. We've got a few questions that I might start with to jump in. We've had a comment from Margaret. I don't know where Margaret's from, so maybe Margaret wants to say her question, or I can say it for her.
Happy to jump in. I'm from West here. I'm a community research organisation, but I've been working with some early childhood services. Part of my voice is a bit fluid. I'm interested in the issue that digital access came. You did touch on it, Megan. I asked the question before you did. We know, particularly in a caravan park, we know that often people will have to go into offices to fill out their Centrelink forms, and their mobile phones, they just can't afford to do it. Was that an issue that came up, or a question that you asked? Because everything is becoming systemically linked to digitisation.
Yeah, it was certainly something that came up. So, I mean, we were interviewing people who work in the system rather than families, but they absolutely talked about families needing support around digital access. Some services had computers that families could use, so they could come in and go through the form in the service. Some brokerage agencies went with families to, say, Centrelink to help them go through the information there. So you know, because also we know that sometimes when you go into Centrelink to say, help, I can't do the online form, they say, well, there's a computer over there you can use. So having someone from a brokerage agency with you in that instance is really helpful to kind of navigate your way through those online forms. Also, in regards to communication between services and families, digital access came up. And so people made a point of telling us that services need many ways that they communicate with families, so that families for whom accessing information online doesn't work, or accessing written information doesn't work, have other ways in which they can find out about what's happening at the service and what's happening with their kids.
Thank you, Margaret. I think that answers the question very well. We've also got a question from Sanella Kolo. Sanella, would you like to ask the question yourself?
Oh, hello, how are you? Thank you very much for this webinar. It was very informative. But I'm just wondering, whatever we have, I've been here in Australia for 26 years and involved in early childhood. But I have seen some declining in all this, and in particular in costs for the family and accessibility, obviously. And my question is, whatever the privatization has plays a large part in this accessibility and affordability for the families.
So that wasn't part of this study. I'm not sure. That's a very large question, Sanella, and I'm not sure that I can answer it. I don't know, Liz, whether you feel able to answer that question.
Megan.
Hi, Jen.
Hello. Hi, Sanella. I think that it's useful to break the question down a little bit, because if we think back to Megan's slide about large providers, small providers, and businesses that own, you know, 2 or 4 services, start to realise that a lot of private services are small families making a living, and then there are also publicly listed companies. So privatisation of childcare is a broad spectrum. I think that one of the things that we identified in the project that was problematic was actually the size of services. So larger services have more capacity to make kind of savings to be able to cross-subsidise support for low-income families. And often small services are left out of training initiatives, service networks, and a whole range of things. There is always a question around publicly listed companies where people are buying shares to make profits. But I think that the problem for the sector is deeper and broader than simply whether services are privatised or not. Now, that said, there is a different model which Megan might want to speak a bit more about, of preschool in Western Australia. Do you want to pick that one up, Megan?
I was actually going to throw to Liz if I can deflect your question. And so I think, so for us, the main issue is around quality and the capacity of services to work well with families. And Liz has a particular insights on this because as well as working with us on this project, she's got young children and she's currently on the management committee of a small community-run service. And so we had some quite interesting conversations about what it's like to be in a service that's a standalone service and not connected to any others, in thinking through, in working out, you know, as Jen said, perhaps missing out on the supports that you might need to work with families. Did you want to jump in on that?
Yeah, I mean, so I had a bit of a break from the project, having gone on maternity leave, and so I came back to it and was able to kind of revisit the findings and some of the new analysis Jen and Megan had done in the last few months. And I think what really stood out to me, and which was highlighted in what Megan said about 1/3 of all services being standalone, is just the capacity of small standalone services to meet the needs of families and children with complex needs. And we've just had a couple of circumstances. It's not like the centre I'm a part of have lots of disadvantaged or families with complex needs, but even one or two really pushes the service to its limits in terms of in terms of the educator's skills and the director's capacity. So I think it just highlighted a couple of gaps for me in terms of where the sector isn't quite there. I mean, the ISP is there, but the family has to agree to it. So if you have a family that is for some reason or another, and maybe it's because of having bad experience with institutions in the past, that they don't want to agree to get ISP support, then the service is left trying to still meet the needs of the family, but without additional support. And there's not really anywhere else to turn to. So I guess one thing I thought through recently was a circumstance where we felt like a bigger organization could actually possibly meet this family's needs better with those systems and processes in place, but there's not even, you don't even know where to turn to try to get that support, either for the family or the service, to all work together and figure out how to best meet their needs. So that's just, my own, it's just reflecting on a bit of my own experience plus the findings, bringing it all together.
Thanks, Liz. Yuvishti, I don't know if you've got more questions you think that we
Yes, we do.
We kind of ran away from those.
That's all right. We have a question from Mark Thomas on costing. Mark, do you want to ask the question yourself?
Thanks. So I'm with the United Workers Union. We represent educators, and one of our one of the key pushbacks is always about cost. And you mentioned that there's not a whole lot of good data on what these best practices cost. And I was curious where you, just your reflections on where you think the discourse is in the policy sphere, especially in the national policy sphere, in terms of taking these kinds of findings on board and adjusting or starting to move policy in the direction that you're sort of implying here.
So there's certainly a move towards having more children accessing ECEC, particularly in the years before school, and so extending the 15 hours in the year before school to 3-year-olds, and making that very cheap or completely free for children throughout the country. To what extent that's been picked up at a federal government level, I couldn't tell you, if that's what you're asking me, Mark. I think it's an important conversation to have. I think we think about the expenses of childcare. I think think we don't have enough of a nuanced understanding about the ways in which costs might vary across the country. And it's, look, I think it's a difficult thing to cost. I'm sorry, I'm not answering your question very well. I think if it's happening, it's kind of at a very early kind of stage, these conversations, and we need better research, I think, to inform them better.
Thanks.
Thank you. And Claire Dissendorf has asked a question on emotional awareness. Claire, would you like to expand?
Thank you. Yeah, I'm a psychology student, and I'm just interested in whether there's any more on those emotional documents that sort of outline families' needs a little better for the educators to follow through with.
Jen, I wonder if you want to answer that question.
Yeah, I'm happy to answer that question. Claire, we can certainly put you in contact with people that have a range of different processes of orientation. But the idea of the practice was that in the early period of families meeting with services and enrolling their children, the directors or key workers sat down with families to work out what goals they wanted for their children, and they developed an emotional care plan for the child. So the goals didn't necessarily, they could have been something like Bobby wanted, of learning your ABCs, or they could also have been something a long way from there, that the child needed to feel safe, or that the parent felt out of control having 4 young children at home all day, that they didn't feel like they could provide a safe environment. So it could be as simple as, I need to get my children to care and get out of the door so that my kids are safe for the day. And that would be a valid and appropriate reason to goal for your children, is that they're somewhere safe for the day. And then as your relationship developed, parents could, had a sort of a very non-judgmental, safe place to drop their kids, and they could add more goals to the care plan for the children. So it was quite a formal process compared to some of the other processes of services, but one of the things Megan said earlier was that for some families are in survival mode, and actually getting the kids out of your care for the day is something that families think or need for their children to be safe, so that they can feel more under control, and then when they're with their children, they can be more of the type of parent that they want to be. So there's such a variation in practices. We are hoping to, in the next couple of years, do a lot more detailed documentation of practices, and to create and disseminate those through quite sort of visual and ethnographic kind of forms of data sharing.
Thank you.
Excellent, everyone. Thank you very much. I think we might call it a day for the seminar. Of course, if you have any more questions that are not answered in the report, you can email Megan at the email address she's provided. And a link for this video presentation will also be sent to all of you who have signed up onto the Zoom account. Next month, on the 9th of March, we have Associate Professor Gabby Ramia from the University of Sydney presenting on social policy and employment relations in Australia and New Zealand. So please come and join us for that. Thank you very much, everyone. Bye.
Thank you, everyone. Bye.